2015, Ethiopia launched its Health Sector Transformation Plan 1 to build on its significant gains in improving healthcare in the last decade. A key focus of the plan was preventing maternal and child deaths. To support this goal, the United States Agency for International Development, with additional resource support from the Korea International Cooperation Agency, devised what was to date the mission's largest integrated health activity in Ethiopia, the USAID Transform Primary Healthcare Activity. Supported with several other resource partners, the activity is implemented by a core consortium of 6 organizations: Pathfinder International as Prime, JSI Research and Training Institute, Inc., APT Associates, Encompass LLC, the Ethiopian Midwives Association, and Malaria Consortium. The activity, which was operational from January 1st, 2017 to September 30th, 2022, strengthened Ethiopia's health system by enhancing the capacity of district and facility leadership, supply chain, and health information system for primary level care. Its work has increased the utilization of quality health services, including family planning, antenatal and postnatal care, labor and delivery, and child health to improve health outcomes for women, children, youth, and their families. The activity also introduced, tested, and scaled up several life-saving innovations. Close to 58 million people across 451 districts, known as Woredas, have benefited through the support provided by the activity to 118 primary hospitals, 1,860 health centers, and 9,347 health posts within the Amhara, Oromia, Sidama, Southern Nations, Nationalities and Peoples, Southwest Ethiopia, and Tigray regions.
The government of Ethiopia set its goals of preventing maternal and child deaths as stipulated in the Health Sector Transformation Plan. USAID also shares this goal in its global programming, develops health projects to address critical challenges in maternal and child health. So the USAID Transform Primary Health Care is one of these, addressing maternal child deaths in Ethiopia. Co-designed through a theory of change exercise that engaged regional and national representatives to define regional and Woreda level health priorities, needs, and also potential actions. So USAID has provided technical and financial support as well as oversight for the last 5+ years.
Based on the previous experiences that the Pathfinder and the JSI and others have gained, building on the experiences and also improving the management, the performance of the health system. That was the key, and focusing on primary health care, the district health offices, zonal health offices, health centers, and health posters, and the primary hospitals, and above all, the community engagement component.
To address the health needs of women, children, adolescents, and youth across the continuum of care, the activity used an integrative approach, covering a wide range of thematic areas.
The core approach of the program, we're using a phased and adaptive strategy, where when we start this activity some 5+ years back, we only started in 300 Woredas, which later grew to 451. The first thing is, through our strengths and gap analysis, we identify what are really the needs of each of the Woredas where we implement our activities. In addition to that, we do partners mapping to really understand who's doing what and where, which will help us first to leverage some of the resources or additional things from partners, but at the same time also avoiding duplication of efforts. Within this consortium had the experience of working together in a previous project. So we are not reinventing the wheel, rather we used already proven strategies and build on that. And the gains from previous projects were used to really complement to the new activities.
These interventions garnered achievements at system, facility, community, and household levels. Performance management capacity of Woreda health offices and primary healthcare units improved, which is both an end result and a means to improve the health service availability.
There have been various efforts that aimed at transforming the overall healthcare system through improvements in reproductive health, MNH, and other areas. We have received strong support and partnership from the activity in terms of enhancing the health system across 16 rural districts and 7 administrative towns across our zone.
ትራንስፎርም ፒኤችሲዩ በጣም እናመሰግናለን። እንደው ብዙ ስራዎችን ሰርቷል።
We are very grateful for the activity for their various commendable efforts in our district. One of the basic contributions of the activity is its successful awareness creation endeavor in transforming the community's attitude towards health service. Thanks to the activity, the government is now working to scale up the interventions into other areas.
The interventions have also resulted in changes in the health-seeking behavior of communities and households, which has positively impacted the demand side of health services. Demand generation activities at the community level increased utilization of different maternal and child health services.
Leenji adda addaatira yeroo baay'ee nuu kennamaa jira. Akkuma dhaabbilee adda addaatti buufata fayyaa irratti.
We received various trainings on different occasions and across several health areas. We have also benefited from experience sharing platforms. The support has helped our health post to become a model healthcare institution in our area. The training, coupled with material support, enabled us to provide improved maternal and newborn health services to our clients.
The contribution of the activity in terms of improving the outcome of care has been immense. To mention few, we have contributed to avert 8.8 million unintended pregnancies, as well as more than 85,000 maternal deaths. With regards to the financial protection, in our case, the community-based health insurance, we've supported the government to establish the scheme in all of our intervention sites, and also supported the system to enroll more than 69% of the targeted population. With regard to the emergency response and responsiveness of the system, we have supported the system through our crisis modifier as well as rapid response fund to contain some of the emergencies happened in our intervention sites. As the capacity of facilities to generate revenue has doubled, as well as the capacity of Woredas measured by a performance standard scores has increased fivefold compared to the baseline in 2017. In addition, the resource absorption capacity of Woredas has also improved compared to the baseline. We feel those three capacities will ensure the sustainability of the changes that we have observed over the last 5 to 6 years.
The close partnership Transform PHCU with Ministry of Health and also with regional health bureaus and with the health sector in general is what makes it unique. So the collaboration starts at planning phase and runs through the implementation and the monitoring and learning phase. For planning and for implementation, they have been working with our system at all levels, specifically at zonal and Woreda level. The activity has been impactful in performance management improvements especially in Woreda transformation. The support from Transform PHCU to universal health coverage support and to Woreda transformation was notable, and it will be one of the best achieved support in our health system. Innovations introduced by the activity are now being scaled up, specifically in regards to supply-related intervention, leadership and quality improvement initiatives, which have been rolled out in more than 200 Woredas, and also in with sub-grants which are now being implemented by Ministry of Health and Regional Health Bureaus. As a further testament to sustainability of the activities effort, lessons from its implementation and publications are being used to inform national guidelines, operations, and policies.
USAID Transform Primary Healthcare's legacy will continue through adaptations of programming in both public health and conflict-related emergency management, and public sector ownership through subgrants for sustained impact. Additionally, response to health emergencies like COVID-19 prevention and vaccination rollouts will ensure the country's health system is able to absorb any future shocks. Ultimately, the USAID Transform primary healthcare activity created positive and lasting changes that contributed to strengthening Ethiopia's health system.